Is it just our group that hears me right now, or is it everybody? Okay.
Message me. Good afternoon, everyone. It's good to be with you again. Well, and if you haven't been here before, it's good to be with you. Welcome to a conversation with folks from the Vermont Department of Health. We have the nurses Katie and Molly with us. We're going to be joined later by Becca Bell, who is the president of the Vermont chapter of the American Academy of Pediatrics. And we're also happy to have Laura Ann with us today. She's an epidemiologist for the state of Vermont. So I'm going to hand it over to Molly and Katie to sort of lead us today. But before I hand it over to them, I need to apologize. I need to apologize to them and to you. Every month after we have these conversations, we collect the unanswered questions, we answer them. Well, the medical professionals answer them, and then we post them on the Let's Grow Kids website. The medical professionals at Vermont Department of Health took the time to answer every single question. And last month we had so many, and they sent them to me to format for posting, which I promptly did. And then they sat on my desktop for a couple of weeks. I forgot to send them to my colleague who puts them on our website. I'm so sorry. This information is really important to have in a timely fashion, and I messed up. So they're there now, and in a moment I will drop the link into chat so that you can reference them if you wish, if you haven't already found them. There were more than 100 questions last month. So in addition to posting the answers to those that we didn't have time to address live, Katie and Molly and I created a short video to make sure that you got a few key points, because there was a lot to cover last month. You can find the video on the Let's Grow Kids website also. Now I am very pleased to hand it over to Katie and Molly to take the lead. Thank you.
Sorry, had to unmute myself there. Okay. Hello, everybody. So just really quickly, wanted to do a quick introduction. Just thinking about wanting to start off by thanking you guys all for your hard work. It's an understatement to say these past 2 years have been difficult. The focus primarily has been on healthcare workers during the pandemic, but we all know that without what all of you do, parents, including healthcare workers, aren't going to go to work. So your work is really the foundation for our society, and a foundation that sometimes can feel like it gets overlooked. So we want to acknowledge, how appreciative we are of your extremely important work. And we continue to be in a state of transition. Transition is not a comfortable place. We all know that by now. We've had 2 years of living with COVID, and as we shift towards endemic status, moving past COVID as a way of life is not easy. It's hard to put aside our fears and move forward when we've had such a long time, when COVID seemed to be the only thing that existed in the world. So it's important to have grace with yourself and with each other. This isn't easy, but we will bring each other through, just so we have the entire pandemic one step at a time. And we've been really good about just really relying on each other. COVID also has shown us the importance of being prepared in emergencies. So we wanted to share with you about VT Alert. VT Alert is used by the state to notify the public of emergency situations. So those include, but aren't limited to, evacuation information, shelter in place alerts, severe weather advisories, roadway interruptions. You can tailor the alerts to specific locations, types of alerts, which device you want to be notified on. So you can really tailor it to what you need. And we encourage everyone to sign up for this program and to be aware of and be able to plan for any kind of emergencies. And Molly will drop the link in the chat to that, to sign up for that if you like. So today we are going to be reviewing the newest updates for the Test for Tots program. We're going to be discussing the vaccine rollout for those under age 5, and then we're going to be answering your questions.
All right. Thank you for the intro, Katie. Hi, everyone. We're going to start off by, like Katie said, talking about the update for the Test for Tots program. So when Test for Tots was first designed, it was based on the Test to Stay program in the school system. But pretty soon after Test for Tots rolled out, we switched to Test to Stay was switched to Test from Home. So Test for Tots has since been updated to more closely align with the Test from Home model. Test for Tots is still going to apply for both community and program exposures, but there are a few key differences that we wanted to highlight. So the first is that all staff and children over the age of 2 may participate in Test for Tots, regardless of vaccination status. The next thing is that instead of looking at close contacts in the program, we're shifting to look at presumptive contacts. So when we think about close contacts, we're talking about people who have been identified through contact tracing as being within 6 feet of someone with COVID-19 for more than 15 minutes during a person's infectious period. Presumptive contacts, on the other hand, are people who have shared a classroom with another person who tested positive for COVID-19. So instead of looking for the infectious period and completing true contact tracing, anyone who is in the class with a person on the day they were found to be positive is a presumptive contact. If your program has kids in classrooms mixing with children from other classrooms, we're going to say everyone in your program would be considered a presumptive contact. If you separate the classrooms, only people in the classroom with a positive case would be considered presumptive contacts. And we know that this will likely feel very similar for you as contact tracing because, you know, kids are moving and playing together throughout the day. So when you had a positive case, in reality, it was likely that the entire classroom was close contacts anyway. But the big difference here is that we're not taking the time to look at the infectious period. So the presumptive contact approach is a streamlined, faster approach, and it's going to afford you the ability to just test more people. So what will happen under the new guidance is that presumptive contacts who are participating in Test for Tots are going to receive a different number of test kits based on their vaccination status. So if you are not fully protected, you're going to receive 5 tests. If you are fully protected, you will receive 2 tests and have the instructions to test on days 4 and 5 after learning of the exposure. And whether you need to quarantine outside of the child care program will be dependent on where the exposure occurs. So if there's a community exposure to COVID, you do need to quarantine outside of the program. If the exposure occurs in the child care program, however, you do not need to quarantine outside of the program. And this comes back to the distinction between close contacts and presumptive contacts. So in-program exposures are not considered true close contacts because we didn't go through the process of contact tracing. So you don't need to follow the close contact guidance, which would tell you to quarantine. But if you're identified outside of the program, that's going to be because somebody was doing contact tracing and said, yes, you are a close contact, which would mean you would need to follow Department of Health guidance for close contacts, which would require you to quarantine. And, you know, as before, this is a voluntary program for both the families and your programs. So Test for Tots might not be right for every program. And within programs, some families may elect not to participate. And there's no right decision. Everyone's situation is different, and what makes sense for one does not make sense for all.
Okay. So next, I'm going to take you through some of the vaccine updates. For the children under age 5. So we're currently awaiting FDA review and approval, and then a formalized recommendation from the CDC on this cohort for vaccination. We expect data to be submitted to the FDA in early April, and probably we won't begin vaccinating this age group in Vermont until mid-spring. So the FDA had planned to begin reviewing the data for vaccine for this youngest age group last week, but I'm sure you've all heard, instead they decided to allow a little more time for evaluation, including data on a third shot for children. So this is opposed, to the 2 shots that we've seen for the older people getting the vaccine. So many people, were disappointed by this delay. We're seeing this delay as a good news. The delay ensures that we're not putting the scientific process at risk of being pushed faster than the data would support regarding the dose and number of shots required for strong immunity for this age group. It means we will have a better picture overall of the vaccine's effectiveness and be better able to recommend the vaccine with more confidence when it's fully approved. Now we'll review the very preliminary plans for vaccine rollout once we do get approvals for this age group. So the idea is that the primary provider of vaccines for 6 months through the 4 years of age will be the medical home, whether this is a pediatrician or a family practice doctor. The goal is that the medical provider will be the main point of contact for either getting vaccinated or getting information on where they can get vaccinated. Some medical practices are banding together in this effort, and also not every practice will necessarily offer the vaccine. But this piece of it is still in the planning phase. The health department district offices in every region will be available to vaccinate children enrolled in WIC and their families. This may look different from district to district, depending on the community itself. Some district offices also will be partnering with their pediatricians or parent-child centers or early Head Start. It's really going to be dependent on what that region sees the need in their community. So existing health equity clinics will continue, and hopefully some new ones will begin, but again, still to be determined. And there'll be also some gap filling clinics as well for people who don't have a primary care provider or where regionally access is concerning and they see the need to develop some other clinics there. Plans are still, again, heavily underway, but the good news is that we have a little benefit, a little extra time to keep planning this. Many kids this age are in childcare. And so our communications team is ready and willing to pull together materials for childcare providers to share with families. Currently, we have a handout called What Families with Children Should Know About the COVID-19 Vaccine, but we wanted to really take this opportunity to hear from you as well. So please share with us any materials you feel would be helpful to have on hand or virtually, so you know your family's best, whether something you can email out is better or something you can have on paper is better, what kind of materials that you need. And so we're going to really depend heavily on you guys to let us know what would actually be helpful. And we really appreciate any feedback we can get from you guys.
All right, we're going to move to questions now. We have a few pre-submitted questions that we'll go through, but as you can see, we're doing much better time-wise than we have in previous webinars. So please feel free to drop any additional questions in the chat and we'll do our best to get to everything. And additionally, if you have any topics that you feel like would be helpful or you'd like to see covered in future webinars, please drop that in the chat as well, because we'd really love to be able to tailor these to your needs as best possible. So we received a few questions about what guidance will be moving forward, taking into consideration there's going to be a vaccine rollout, updates for tests for tots, and changes to masking in schools. So a lot of questions about, what will the guidance be for kids under 5 who choose not to be vaccinated, and what will the guidance be for masking? And unfortunately, we don't have a great answer for this. As we've seen throughout COVID, guidance changes over time, and it's based on what's happening with the COVID landscape. So we really can't say what the guidance will be in the future because we don't know where we'll be at in the future. But we will do our very best to keep you informed and let you know when these changes do occur. You're muted, Katie. You're still muted.
All right, sorry, I'm trying to use my cool headset. Should we anticipate that any changes to masking recommendations for providers would require programs to not have stricter masking policies to still be eligible for the testing program? So we're just going to read directly from the FAQs on the Test for Tots page here because it really specifically answers this question. So in order to participate in Test for Tots, all conditions of the program, including allowing children who cannot mask consistently to participate, must be followed. If you agree to participate in the program, stricter masking requirements than what's already been laid out in the guidance cannot be used.
Where can we find written guidance for childcare programs? There's no longer the guidance posted on the Department of Health website. So a reminder that without the executive order, Department of Health isn't issuing any formal guidance, but there are a few places to refer to for recommendations, and we'll send you, Katie will drop these links in the chat and we'll email them out after as well. The first place we would say to look is on the CDD webpage. The COVID-19 advisory memo from August has the basic considerations, things like staying home when sick, masking, that's included in that memo. If you're participating in Test for Tots, you should be referring to the CDD's Test for Tots webpage. If you're not participating in Test for Tots, on the Department of Health website, there's a childcare and out of school program page, which has COVID-19 resources and information on contact tracing. For any questions on isolation, on the Department of Health website, what to do if you test positive for COVID-19, their page there, they walk you through isolation. And similarly for quarantine, if you go to the Department of Health, what to do if you're a close contact, that page will walk you through what you should be doing as far as quarantine guidance. And again, those are in the chat, and we will also make sure to have that all emailed out. So moving to the chat, the first question is it true that we need to go back 2 days prior to positive case for contact tracing? So if you are contact tracing, it is still looking 2 days back for the infectious period. And Laura Ann, correct me if I'm wrong, but if you're doing contact tracing, yes, that is true. Just the reminder that that is for contact tracing, but Test for Tots is no longer doing the true contact tracing. So that's where the difference is. So this would be for someone not doing Test for Tots. Is that anything you wanted to add, Laura Ann, on that?
No, I think that sounds good. If you want to discuss more about what that Test for Tots scenario might look like, we can certainly do that. But since the question was specific to contact tracing, I think you covered it. Thanks.
All right, thank you. The next question, to clarify, if we keep our infants separate from those in Test for Tots, so when there's a positive case in our infant class, do the infants quarantine inside and outside of the program? So yes, infants cannot do Test for Tots as they are under 2. The antigen tests are not approved for them. So if there's a positive case in that class and everyone in that class is a close contact through contact tracing, those people would need to quarantine. They should not be going to the program during that time. They should be quarantining for the 5 days and then can get out of quarantine if they meet the requirements. Any other questions that people have or things that we can help you with?
It is amazing to me that we have that we don't have like 12 or 15 questions. So if there are any scenarios, I guess I'm going to back up. We have been having these conversations with the primary focus being around COVID and COVID related practices and wellness. And in fact, the professionals we have with us can speak to any topic that you want to discuss when it comes to health and well-being in your early childhood programs. So if you have something else, you're welcome to ask that as well. You don't have to limit it to Test for Tots or COVID or vaccine rollout, et cetera. And I am so excited to see that there's a handout about what families should know. And I'm wondering if anybody, it's hard to like I want to go look at that and I want to not miss what you're saying. And I'm just wondering if anyone on the call today has seen it or, did take a moment to look at it, because your invitation about what, programs need is really welcome. And I'm just wondering if folks, even if you haven't had a chance to look at it, like, what do you hope it says? And now the questions are coming.
So I was just going to jump in with this first question while we're waiting for other comments. What should we expect? When should we expect updated recommendations from the CDD? So the CDD works really closely with the Department of Health to keep up with the latest recommendations and to, you've seen them adjust Test for Tots to be in accordance with, what the schools are doing and sort of keeping pace with that. So there isn't a specific timeline for updates from the CDD. It really just depends as information changes. Like I said, we're really in close contact and keeping up with the changes as they happen, and CDD also reflects that. So I don't think that there's any specific timeline for that.
And I would add to that, if you look at that memo from August, I know, especially in COVID time, August feels like forever ago. And it's like, how do we not have a new memo since then? But if you look at that memo, a lot of the stuff is what we've learned to be basic COVID common sense things, like staying home when you're sick, washing your hands, masking when you're indoors. So things that, even though it seems crazy that it's been since August, those things still stand. So I think the other thing is looking at, if we learn something about COVID that changes how we should be doing things, that would be when we would see updated recommendations. So like Katie said, there's not an exact timeline with that, but if there's a specific recommendation you're wondering about that you feel is out of date, please let us know and we can look into that as well.
Okay, and the next question is, when children are sick, can we follow the pediatric flowchart and have them take 2 tests, and if negative, return if symptoms are improved? I would love if Becca Bell wanted to step in here with some specific pediatrician recommendations.
Yeah, and I can put the, if it's not already in the chat, we can put the flow chart into the chat too. So yeah, that's part, if a child's old enough to take a rapid antigen, so they're over 2, then that's one pathway back into care. So, and I love whoever asked the question nailed, the important piece, which is that their symptoms are improving, because we know that sometimes early on the rapid antigen doesn't pick up on it. The other thing is that so for those who don't know me, I'm a pediatric intensivist. So we are seeing other viruses. We are seeing some RSV. I saw my first ICU admission for flu over the weekend. So in a pediatric patient. So we are seeing a little bit of some other viruses as well. So we also don't want to spread that stuff around. I'm sure everyone is familiar with this lovely GI bug that's going around, seems like this week. So so I love that you all are experts in the whole symptom management, because you've been doing this always, and that will continue to always be this mainstay, is sick children stay home. But yeah, so doing the 2 rapid antigens is a pathway back into childcare when symptoms are improving.
Again, for children over 2 with antigen tests, so that being the caveat.
All right, the next question, are there best practices about specific types of masks for kids in care? Becca, I'm not sure if you have a thought on that. I know that lately we've been talking about the KN95 as the gold standard. I don't know if there's a specific consideration that you would add to that.
No, I think it holds true that the mask that children wear most consistently is going to be the best mask, and that's especially true for this age group, and of course for children over the age of 2 again. So I think whatever, I think well fitted is the other word that we sometimes skip over. So even just thinking about a mask that's going to stay over their nose, a mask that's not like really, really open on the sides, will be helpful as well. So if it's a KN95, but they're like pulling it down, then that's going to be less helpful than something that's more comfortable to them. I'll say that I tried a KN95 with my 4-year-old who's in childcare, and he tried, but it just didn't fit his face right. It was like going up into his eyes, and he was like, you know what, Mom, like maybe when I'm older I can wear this, but not now. So he went back to his other mask. So again, I think it's what they can do, and then the well-fitted part is helpful. So like I do think the masks that have like a form to them can be helpful. Is that the right, like a structure to them? So the nose stays up. So when they're talking and stuff, it doesn't keep falling down, and that the sides are pretty well fitted to their face. Some kids really do the surgical masks really well, and those are nice because you can just like wear them a bunch and then throw them out when they get gross. So that's another option too, are those pediatric surgical masks.
Awesome, thank you. So the next question says, so if someone tests positive on Sunday, we no longer have to go back to who was in the class on Friday and have them test. So this is kind of a two-part thing. The first is if you are not doing tests for tots, you do need to go back to Friday and do the full contact tracing. If you're doing tests for tots, this is where you think of COVID like any infectious disease. You know, if you had someone with chickenpox, you got a call from a family member on Sunday and they say, my kid has chickenpox today. You know, think about how you would do that. You would likely say, oh, you were in class with all these people on Friday. Like, let me reach out to them and just give them that heads up. But the other thing is we know that you guys have a lot going on, and this is complicated, and it seems like there's so many different scenarios. So the other thing is, if this is happening and you're like, I don't know if I should be testing or not, call us, you know, reach out to us. I'll put the number again in the chat, and just remember that we're here as a resource for you, because this is really complicated to go through on your own. And Lorianne, I don't know if you want to add anything.
Thanks. No, I appreciate the example, and the context of the question before was, you know, going back 2 days, but that didn't assume that a test was coming in on a weekend. And so I just want to say, like, a test coming in on a weekend and then that being a Saturday or Sunday doesn't mean that you ignore this situation and there's no opportunity to notify those classmates when you know that that child was in class on, you know, Friday or Thursday, and we would otherwise consider those classmates to be presumed contacts. So I hope that helps clarify. Thanks.
Thank you. I saw we have a suggestion. I'd love for a future topic to be on the new CDC milestones as they roll out perhaps a co-VDH Help Me Grow presentation. Love that suggestion. Absolutely. I have copied it into my notes, so we will not forget it, but that is an excellent suggestion. So thank you so much for that. The next is saying, I'm not following quarantine guidance. Can you clarify further? If there is a positive case in the classroom and you are using tests for tots, is any child who is exposed 1 to 2 days prior to the positive case not to quarantine/test for tots? So I may mess this up depending on my understanding of the question, but if you are doing tests for tots and you you have a child in your care and later that day, for example, they get or they test and they are positive, whether you find out a couple days later or whenever you find out, the kids that were in the class with them that day would be participating. They would be presumptive contacts, and you would participate in tests for tots. Again, taking into account, if it was taking into the account that thought of, if you had a chickenpox case, you would likely tell people the day before just to give them the heads up. So that's who would participate. If I just said that clearly, I may not have, honestly. If the exposure is occurring in the childcare, they do not need to quarantine. We still have them test every day before they come in just to make sure that you're safe. But part of what the presumptive contact approach is doing is saying we're taking a larger pool of people who may have a lower risk, whereas contact tracing is a smaller pool with a higher risk. So you still want to be testing. In both cases, there is a risk. You still want to be testing them, but because it's considered a lower risk when it's an in-program exposure, you don't need to be quarantining outside of the program. I don't know if that was clear at all. So if anyone else wants to jump in and add anything, please be my guest.
Maybe Laura Ann can jump on again. I just want to say personally, I find this aspect to be confusing. So I'm totally there with everybody. I think that it is an aspect of how we're trying to move towards really, I like how Molly's kind of describing like the pools of people, and it's like easier to test now and it's not as restrictive. And so it's like, okay to test more people because it's not as hard to do when you're not telling people they need to stay home. It is a little bit confusing. I think it's even more confusing in the childcare setting than the school setting because, some kids only go to childcare Monday, Wednesday, Friday, or they go 1 week, they're not there the next week. And so it's not always like so-and-so second grade class, it doesn't really matter what day it was, like everyone should just test. Like this is a little bit more confusing. So I don't know, Laura Ann's like on the ground talking to you all. So I think she could give some specifics about this, but I do get that it's confusing.
Definitely. Yeah. Thanks, Dr. Bell. I think my one caveat is, and this is my understanding and interpretation, that if a facility is enrolled in Test for Tots, but a family is choosing not to participate in testing, if the family is saying, nope, we don't want to test, then that child should be following health department quarantine guidance if they are identified as a contact. So I hope that makes sense. So if a child is identified as a contact, if their facility is participating in Test for Tots, but the child's family is choosing not to participate in that, then the child would be recommended to quarantine following routine health department guidance.
And the thing
may I ask for one clarification? I know you're very intentional. Each of you is very intentional about saying require or recommend. And I just heard Laura Ann say recommend. And is that so? Recommend specifically and not require. And the reason I ask is because often it's really empowering for program directors to be able to say to family, we're required to do this.
That is a great point. I feel like a little bit beholden to some of that more precise wording, because to actually require something would in effect, would require a health order for us to be able to enforce it. And so, it is our very strong recommendation. This is our guidance. This is what we want people to follow. But, you know, we're not going to be knocking on their doors and standing outside and making sure they don't go outside. So I hope that's not trying to let ourselves off the hook with the wording, nor minimize the importance of what we feel is the recommendation.
Not at all. And I really appreciate you saying that. I think, you know, as a former director, I would like probably quote you on that. I would say they strongly urge, you know, because I feel like it's really nice to be able to present as I'm not making this up. You know, there are reasons that the guidance exists. And it's so great to be able to say the American Academy of Pediatrics and the Vermont Department of Health are backing me up on this practice, on these practices.
And I think Laura Ann again brings up the great point of why it isn't required and the health order that would be needed for that. But what we also tell you guys is, you know, you are all running a business. And so we are giving you these recommendations. And if you use these recommendations to create a policy for your childcare, you know, that is, you can say, here's our policy. This is what we are requiring for entry into our business. But this is the health recommendation that backs this up and says, this is what you should be doing. You know, it's not as nice as something wrapped up with a nice required, but it is, you know, just a thought on that. And the other thing I just want to add is with this question, you know, you saw all of us here answering and also feeling like this is so tricky to try and figure out and how to answer it. So when you have these questions, know that that's so valid and this is such a complicated thing. And again, know that we are a resource for you and we really encourage you to reach out when this is happening because it's just, there's nothing simple about it.
And it really helps us and the CDD as well when you do reach out with questions, because we know where the sticky points are, what needs to be clarified, is there a gap in the guidance, you know, those sort of things. So it's really important to reach out for that reason as well. So the next question here is, can there be an updated notification email or letter for when Test for Tots needs to happen, please? And that is certainly something we can bring back to the CDD and, you know, let them know that people are wanting a more updated version of that. Anything else anybody has to add? Or
I've added that to my list, so
okay,
I will make sure we'll make sure to pass that along.
Will we be verifying COVID vaccinations? Test for Tots says that masking could change when we have an 80% vaccination within the program. So are we now supposed to track vaccination rates for ages 6 months plus to identify when 80% is reached? So I think there's two different questions here. One is, are you actually verifying the vaccination status? And the second question is, are you tracking? So I'm going to jump in and then obviously feel free to jump in for some clarification. My understanding is that there isn't going to be verifying. You're not required to verify the vaccination status is similar to, I'm not positive that will be, you know, I'm not sure if they've even clarified that question yet, but my thinking is it's probably similar to the testing, antigen testing. So they're not requiring you to check that the antigen was negative prior to the child coming into the childcare. And then Molly, do you have something to add? I see that.
So, yeah, the thing I was going to add about this whole question is I think it's a great question. I think it's definitely looking ahead and figuring out how you're going to work things, which is, we love that. I don't know the exact answer, but once again, I added it to my notes. And I think that this is something that is really helpful for us to know this question so that we can go to, you know, CDD and immunization and say, like, what's our plan for this? We might not have an exact plan right now as far as, you know, do we want you verifying? Do we want you just asking parents, are they vaccinated or not? I don't know what that will look like, but knowing that this is something to think about, we can bring these to people so that we can get that incorporated into the planning.
I also want to just interject that I'm sorry. I keep having my sort of former director hat on, and I'm thinking about how we currently are required to document all immunizations, and so we know that this is a new one, and that there aren't guidelines around it yet. So I think that's also the place where directors might be coming from. Sort of, when does this become a part of the thing that we report along with the other immunizations?
Yeah, I think that's understandable. And yeah, well, I said, well, we'll definitely follow up and ask also sort of if they have recommendations for mechanisms for tracking vaccination, things like that, and knowing that don't have the same staffing that a school does as far as tracking goes, and school nurses and administration and all of those pieces. So Grace Winslow asked a clarification, please. I think I missed something through bad audio. Community exposed staff or children should quarantine, not attend, or only quarantine from the community. And in-program exposed staff or children should not quarantine. And is this only for programs with or without Test for Tots, staff with or without vaccinations, and is up-to-date vaccination, including a booster? That is a lot of questions rolled up in one. I wonder if Laura Ann, if you just want to go through that and see if there's something that we hadn't covered. I'm not quite sure if we covered some of these questions already.
All right, I will do my best. Y'all please jump in if you hear me going astray. Okay, so where there may potentially be some confusion is whether they're able to go to childcare is one thing, and then what their activities should be outside of childcare. It might be something else. So let's give an example of someone who has a household contact who is a COVID case. You have an unvaccinated child who has an exposure within their household setting. So they are a close contact identified because of that exposure, which is occurring outside of childcare. It is separate and distinct from their any possible or theoretical exposure within a childcare setting. So that child can continue to go to childcare if they are testing and participating through Test for Tots. There are specific recommendations for the intervals and when they should be testing, and I can speak to that in a second. But that child should not be going out and about in, the community. They're able to go to childcare because they're seeking testing. If as an alternate example, that child was identified as a classroom contact to a case, or as a presumptive presumed presumptive contact within a classroom setting, that's not a true close contact situation where we would be recommending that they quarantine in all other aspects of their life. So I hope that distinction makes sense. And then if it's a situation where, like back to the household, where a child is having this ongoing exposure to a household member, we would recommend that an unvaccinated child, that they are testing daily throughout that time frame, and then an additional 5 days following their last exposure to that household contact, so that the household contacts, the case, that household cases last day where that person is infectious, then the child tests for an additional 5 days after that if they are unvaccinated. So does that make sense? Should I clarify anything?
I think that makes sense. I want to just say, like, really explicitly, just so that we make sure, like, I think those examples were really helpful for me, at least, but just to put it just plain black and white, if you are a program that is doing Test for Tots and one of the people in the program is exposed in the community, for example, in that household exposure, they need to quarantine outside of the childcare program. They can still come to the program while doing tests for tots, but they need to quarantine outside of the program. If the exposure happens within your program, they should test during that period, but they do not need to quarantine outside of the program. Just putting it as clear as possible, because I know this is really, really confusing. And that again is only if they are doing tests for tots. If you are not doing tests for tots, it's doing close contacts and people should be quarantining. And as far as up to date, yeah, so up to date, if you are a child, so your 5-year-olds, if you have any 5-year-olds who are vaccinated, as long as they have received both shots for that primary series, they are considered up to date. If you're an adult, you need to have completed your primary series and gotten your booster once eligible. That's the up-to-date definition. And I believe that was, I believe we got all the questions in that, but Grace, if we miss anything, just please prompt us. The next question, at one time there was a pediatric flowchart for making decisions about tests for tots, days to return, how to decide to exclude and how long, etc. Will there be another one of these sometime? So I'm not sure. So I know one pediatric flowchart in the past, which was used a lot in schools and childcares. I don't know that it specifically was about tests for tots. If you look in the chat, we did drop, I'll put it in again, is our most recent pediatric flowchart that talks about, you know, symptoms of illness, things to take into consideration when you can return to school. It refers to if you do test for tots or test at home or test from home, you know, you need to look at that policy, but this is a basic, you have a new illness, what to do flow chart. So I take a look at that, and if there's any questions about it or you feel like there's something that's still missing or unclear, just let us know. Next question, our school district will likely relax mask wearing over the next few weeks. It is challenging for families in our programs to keep masking when the rest of the community is not. Do we anticipate that we will keep masking in early child care programs until our youngest children have access to the vaccine, or is that impossible to predict? Unfortunately, to my knowledge, impossible to predict. I think we're caught in, like we said, that transition period where we have so many people who are vaccinated and people wanting to move forward and lift the masking, and we're trying to be cognizant of the fact that not all of our people have had that opportunity. That being said, I don't know that we have the ability to predict that unless anyone else has any insider knowledge.
Yeah, no, I don't know. I mean, I would say that, you know, the benefits of universal masking are there when there's a lot of cases, and that just as a reminder, you know, if families are asking about it, is that the health department is recommending that everyone over the age of 2 wear a mask indoors right now. Like every one of us should still be wearing a mask indoors. And so that's sort of an easy thing to point to. I think the bigger question is going to be how we think about the childcare space once, if that changes at some point, because cases, a combination probably that I'm sure the health department will consider things like case trends, hospitalizations, ICU capacity, like those sorts of things. I will say that you all have been are really amazing with masking in general, and that you've got like some parts of your population that can't mask because they're under 2, and then you've got the 2-year-olds who you're like teaching to mask, and they're kind of doing it and they're kind of not. And I think that you all have a lot of experience with varying degrees of masking and acceptance of that, and I think that will be helpful in the transition period, however it goes, even more so than schools, right, that are just like it's like everyone's wearing a mask or no, so I think that you all are really good at understanding that and really doing the best you can with with an age group that's pretty challenging. So at some point we'll have to get used to, people, for the schools, just even like preparing them that at some point we'll be at a place where some people are wearing masks and some people aren't, and being accepting of that. And I think you all are already there because you do that every day anyway. But yeah, I can't predict what a real recommendation will be for the childcare space right now. I do think that the ability to vaccinate is something that we always consider, and we don't really know the timeline quite yet on that either.
All right. Next question says, the testing kits that we have been sent have 10 tests in them. We have been giving a whole kit to families when their child has been exposed. Should we be breaking these kits apart and only sending home 2 or 5 tests depending on exposure? So part of the authorization for that is you cannot be breaking the kits up. So you would send home a full kit with a child, and knowing that they're going to use either 5 or 2 kits this time, and being able to say to the family the next time there's an exposure, okay, use the second half of your test kit or use an additional 2 tests from your test kit. I know that's easier said than done, and there's likely people who will use their tests outside of Test for Tots, but we have to, kind of give the good faith that they are using them as we are requesting. All right. If a positive case was in the class yesterday, would we have children who were in the class 2 days before do Test for Tots along with the ones in the class on the day of the positive test? And I think this is what Becca was talking about with the complications of, you don't have kids in the class, it's not like school, you're in it 5 days a week all the time. And so this is where it's tricky. And again, call us if you have questions and want further clarification, but it's okay to use your judgment. And, you guys do this with infectious diseases all the time. If you, again, going back to chickenpox, if you have chickenpox in the class on Wednesday, and someone wasn't in the class on Wednesday but was there on Tuesday around the kid who now has chickenpox, you'd be letting them know. And so think of it in that way of just infectious disease protocols across the board. I know it's not a super clear written out. I know it's not super clearly written out, but just thinking of it as this is an infectious disease, and what do we do with infectious diseases, and calling us if you want clarification or I just need to talk through this, just give us a call. All right.
Which one of us is reading it? All right. So I'll jump in. If unvaccinated staff worked in a classroom with a positive case, should they test, quarantine, and test out of quarantine on day 4 and 5 before returning to work? I guess in my question on this one is this in a test for TOTS?
And I'll also add, she did ask below, answer the question if the teacher has symptoms and if they have no symptoms as well.
Oh, okay. Thank you for putting that. If they, feel free to jump in. I feel like I'm gonna get my foot caught in something, but so if they're involved in Test for Tots and they're exposed but have no symptoms, they would be following the testing for 5 days. And they are not required to quarantine from the program. However, if they are not involved in Test for Tots and they're unvaccinated, then they should follow the Department of Health guidance around quarantining and testing out of quarantine on day 4 and 5 before returning to work. And then
it is all with no symptoms.
Right, that's all with no symptoms. And then if they have symptoms, then we are requiring them to follow the quarantine guidance while they have this. They should be quarantining while they have symptoms and testing out of the quarantine once the symptoms are resolving. Is that making sense? Am I saying that correctly? Laura Ann, do you want to jump in here?
They should definitely seek testing if they are symptomatic and only, return if they have negative tests. So, I mean, and the assumption that their symptoms are due to something else. And so that is a situation where we would be encouraging a PCR or LAMP test, probably above and beyond an antigen if they've, we would prefer that, but they should be seeking testing and they should have a negative test before they return.
All right. If we require something that the VDH recommends and we are using Test for Tots, is that okay? So it's mostly okay as long as you are not going above and beyond what Test for Tots says. So if we're requiring something and it is in line with the or if we are recommending something that is in line with the Test for Tots guidance, that's okay. If you, if you look at, if you say, for example, if you're I'm trying to think of a good example, but if there is something that you want to require, for example, you have to be able to mask consistently after an exposure if you want to come into the program, that's beyond what Test for Tots has laid out in their guidance. So you would not be able to do that. So recommendations, you can require them as long as it's not going above and beyond what is laid out in Test for Tots. And if you have questions about specific ones, again, I'd recommend just reaching out and we can help clarify.
Just looking at this next question, and I think that we have the perfect person here to answer these symptoms questions. I wonder if Becca, you want to jump in? The question is, we haven't talked about signs and symptoms to look for in a while. Are we still looking for 2 or more symptoms? Do we recommend that families administer a home test?
Yeah, I think that's where that pediatric flow chart comes in. I think that Molly put in the in the chart. But yeah, it's that piece. Hold on, I'm actually just trying to pull it up. That piece really hasn't changed in terms of when we're asking people, and like really a lot of it is thinking about new symptoms. So new symptoms need to be ruled out, meaning tested.
We have just a few minutes left and just a few questions. So I don't know if you want to sort of scan them. One of them is a comment, thank you. So I will mark that as answered live. You're welcome, Grace. And see what you can get through in the next, say, minute and a half, and then I'll just wrap us up.
Can I just jump, just because it's about the symptoms? Lori asked about, this is a good question. Previous guidance recommended a PCR test if a child under 2 is symptomatic and it persists for more than 24 hours. So, Lori, that was sort of based on, sometimes kids will have like very brief illness, like they vomit and then they're fine, 24 hours later, our feeling was that really wasn't COVID. And so if they really had that kind of symptom that's really short-lived and it's totally resolved and they can come back to childcare without a test. What we were finding though is that like in this era of like lots of COVID around, most things were COVID, and if people waited 24 hours to then go get a test, they're just sort of delaying the whole process. And so again, if we look at the so if they have they really, at this point, should really just go get a test. I think that was sort of back in the day where children couldn't get tested at community sites. They were having to get like an order from the physician. And by that point, their symptoms were already gone. And so that's why we said if it was less than 24 hours, they could come back. But now we're just having people get tested because it's a little bit more accessible now.
Thank you. Thanks, everyone. So there's another there's another question or reference to the flow chart. And I think what we'll do is there's so few unanswered questions that perhaps what we can do is directly answer those to the folks who posed them, because it's time for us to wrap up. And I know that people have to, and Lorianne had to leave. I wanted to thank her. Well, please be sure she knows that we're grateful that she could be with us today. But we'll get back to you if you had a question. We'll answer you directly. And we're so grateful again to have Katie and Lori and Dr. Becker Bell with us today. And if you want to share this link there, if you want to share this webinar, this conversation with colleagues, it will be posted probably by the end of day tomorrow on the Let's Grow Kids website, but we won't be posting answers to questions this time because we're going to answer them individually live or individually. So anyway, have a great afternoon. Thank you so much.